We are at the end of this osteoma removal. There are two of them. This is a much larger one over here on the right side and the hairline. And actually it looks a little raggedy because that one did not come out very easily. It had to be first chipped off and then rasped down, which is interesting. Most times when I remove these, I notice that patients have very similar ones. Either they're both chipped off or they are hard to remove. And this one was hard on the right side, and the one on the left was relatively easy, which is nice because it was very far. What's interesting is cosmetically, this looked much worse. It was very obvious, and that's the reason she had this done. This one was a much larger one. Again, you don't see the full extent because it's been rasped, but it was very easy because it was so close. Unfortunately, the easier one was farther, and so what I always try to do is make an incision along the hairline. This is a little bit longer incision. It is an incision that is a trichophytic incision, meaning I try to let the hairs grow through the scar. But also, if you look over here, I try to avoid making an incision here. And so a longer incision allows me ability to get around this curvature of the forehead, but sometimes I've just got to make the incision there, and they're always consented for that. I've closed the incision in multiple layers. This is a periosteal, galeal, and subcutaneous closure before I close the skin. These are dissolvable sutures which heal well, and then I put dilute Botox, or I call Supertox, to make sure the incision heals well. She's going to be doing some Polyflow spray, which is a product I developed to minimize potential of shedding around the hairline that can occur in the first 6 weeks. And that's something you get on Amazon. It's something that I've used to help minimize shedding in areas where incisions are in vulnerable areas like the hairline.